What If, What Now is a Novartis oncology initiative to explore the present state and the possible futures of CML. Chronic myeloid leukemia, often known by its initials CML, is a cancer of the white blood cells. But CML is not like a lot of other cancers. Major scientific breakthroughs over the last 50 years have considerably changed the treatment landscape for patients. If appropriately managed, CML can often be considered a chronic condition rather than an acute disease. But we mustn't forget the seriousness of any cancer diagnosis. Being told you have CML is still a huge shock, but people can come to terms with their condition, learning how best to integrate it with their everyday lives. But a cancer like CML comes with its own set of challenges. Despite their often positive outlook, patients have fears and frustrations that can't be overlooked. CML has a continued impact on patients and their families even long after diagnosis. Despite advances in treatment, patients must still live with their cancer, and psychological support is often needed. Without that support, some patients can feel very alone. Some patients in clinical trials are switching from one treatment to another, or even discontinuing treatment after demonstrating a deep molecular response. Patients need to feel in control about their treatment. With so many advances in recent years, open, honest, and regular conversations between doctor and patient about their medication are important. But these are not always fully understood by patients. Medication plays a vital role, but reassurance is key. What do the side effects mean for me? Is my treatment being properly monitored? What happens if I relapse? It can be incredibly frustrating if your CML is not taken seriously by those around you. You may not look ill thanks to effective treatments, but that doesn't mean you aren't suffering. Patients need reassurance and support from those around them, but for many family and friends, CML is still a mystery. They may have misconceptions which need challenging. For example, CML certainly isn't contagious. As with any condition, the needs, fears, and hopes of patients will change as their treatment evolves. CML is a cancer that has already seen dramatic developments in a very short space of time, and the change continues. Many in the CML community are now talking about the possibility of a deep molecular response, where a patient stops taking treatment and is monitored through a closely managed process. But as new options become possible, so do new dilemmas. Some patients will be making decisions about their treatment that very few people have ever made before. We mustn't forget the emotional burden. This is a hugely exciting but very uncertain time for patients with CML.